Hello, everyone. Welcome to our webinar. This is a fireside chat. I'm Drew Schiller, the co-founder and CEO of Validic, and with me today is Jared Saul, who's the Chief Medical Officer of AWS. I'll let Jared introduce himself a bit more here in a minute, but just a few housekeeping items as we get started. One is, looks like our chat is disabled. We do have a Q&A box available, and we would love to treat this as a little bit of a AMA call. So ask me anything. I've got questions to prompt some discussion for Jared and myself, but certainly we'd love to have you put questions into the Q&A box as they go. And if it's relevant to what we're talking about, I'll bring it up at the time. And if not, maybe I'll save it to the end. But definitely would love to have a lot of audience engagement and participation here. And today we're talking about AI and specifically generative AI and how it can relate to healthcare. Really excited about this topic. There's a lot going on in this space. And so I'm not going to give a long intro on it. I think everyone's pretty well versed. But just to say, this is an area that is very near and dear to my heart. We recently just launched a new product this week called Validic Sparks that use this. I'm sure we'll talk a little bit more about that. But at a high level, I think this is going to be a really great, timely conversation. And as mentioned, I'm the co-founder and CEO at Validic. Validic is the personal health data company where we bring all the in-home data from all the in-home wearables, health apps on the phone, in-home health devices into the healthcare system with some AI and really help healthcare providers deliver better, more proactive care, helping them become data heroes as opposed to just data historians. And so, Jared, I'll turn it over to you maybe to give a quick intro on yourself and a bit about your background in the space.
Yeah, thanks, Drew. I'm going to use the data heroes term. I like that. So Jared Saul, I'm the Chief Medical Officer at Amazon Web Services. Started my career as a practicing neuroradiologist and then became an entrepreneur and a tech investor for about a decade and a half. Joined Amazon about 7 years ago. And as you can imagine, in my role here, I spent a lot of time across both healthcare and life sciences talking about data and AI, and of course, generative AI. So very timely topic, super interesting. Still the early days, but should be a good discussion. So thanks for having me, Drew.
Yeah, absolutely. Absolutely. So, why don't we just jump into it? I'm curious, how do you think that generative AI might change healthcare delivery in the next 3 to 5 years? Like, will it change things? Will it be material? There's a lot of talk right now around the ambient dictation, things like that. I'm just curious, how do you think the landscape will shift?
Yeah, that's a big question. I'm curious for your thoughts on this, but from where I sit, like, there's no doubt it'll change, healthcare. And I don't even think it's 3 to 5 years. I think it's starting to happen now. Um, some really obvious ways, and some a little more subtle. But I sort of look across the entire landscape, and I don't see a single part of the healthcare delivery continuum that isn't or will be touched by generative AI. So I think about patient engagement and navigation and accessibility, and the sort of ongoing personalization and consumerization of healthcare. And Gen AI is just a fantastic enabler for all of that, right? And then, like you said, all of the sort of physician and administrative burden that is kind of the low-hanging fruit for generative AI applications in some ways, because it's, for lack of a better term, relatively low-risk applications, generating summaries or helping draft messages for inbox or, these kinds of applications, ambient documentation, so physicians aren't spending all these hours writing notes after they see patients all day. Like, these are fantastic applications of AI, and they're creative, right? Like they just add to the efficiency and the quality and volume of care that can be delivered. So I think it's happening today. I'm a radiologist, and we've had AI in radiology in some form or another for at least a decade now. And GenAI is really accelerating that. And I think the imaging focused specialties are particularly prime for this. But anywhere where there's large data assets and you're trying to figure out what the patterns are and distill signal from noise, like, this is a fantastic technology. And I am saying that to tee you up, Drew, a little bit to talk about some of the work you've done with it.
Yeah, absolutely. Yeah, thanks. I mean, we certainly, I see things in a lot of those same ways, and we certainly have a nice data set at Validic, right? Where we've had 20 million people use the platform with personal health data over the last 12 years. And we've been thinking a lot around like how do we use this data set to help our our clinical partners become more effective, right? And so to your point, I think we actually made a foray into that earlier this year where we launched a product using Amazon Bedrock, which is the AWS product that allows for you to use um, different generative AI models on the back end by building once to the Bedrock platform. And what's really great about that is it gives us a lot of flexibility in the future. But with that, what we did was we created really along the lines of what you're saying, like available today, right? Clinical summaries of patient RPM data in the EHR clinical workflow to just take the cognitive load off of clinicians so they can just really quickly, rather than like kind of evaluate the data, they can just look at what like the output and say, oh, now I understand what's going on, right? And then there's always more data if they want to dig into it. And then we all can also generate a clinical progress note summary to that they can then edit and then save right to the chart. But when I think kind of 3 to 5 years, I think like the biggest thing, at least what I'm hopeful of, is that generative AI will help with hyper personalization for patients, right? So it's like there's a lot around patient education and patient engagement, but I think like understanding the full context of the patient, it's hard to do without AI. With AI, you can now start to know like really everything that's been going on with this person and start to tailor messaging specific to them. And that is, absent clinical diagnoses, that is absent clinical guidance, like that is just literally just how can we make this patient feel more seen, more a part of the system, more welcome here, more that they have a voice in their care. And I think that's a real opportunity with generative AI that's just hard for our clinical teams to do right now from just a bandwidth perspective. Um, so I'd love to maybe kind of pull on that thread a little bit more because I said absent clinical decision making. Do you think that generative AI will evolve to start to be a true partner in clinical decision making? And like, if so, in kind of what time frame?
Yeah, you with the time frames again.
Well, because I mean, just to name it, like that is like healthcare is a understandably very
Yeah,
conservative
that's right.
space, right? And I can't imagine, I think patients will probably start to find clinical value from this before clinicians. So I'm wondering like when will clinicians be able to
Yeah.
lean in?
It's a good question. And, look, like part of the complexity there is it's depending on the specialty and the nature of the practice. Like people are in different places in that journey, right? So I think some very forward-leaning health systems are probably already getting benefits from using AI in clinical care, viewing it, I don't know if it's necessarily a clinical decision-making partner at this point, but it's certainly supportive. And I think that as these capabilities only get better, like this is the worst it'll ever be. We'll see more and more algorithms actually venture across the FDA approval chasm and become, full clinical decision support systems. So there's what 900 algorithms that are FDA approved now. So happens the vast majority of those are in medical imaging. I think 90% are radiology. And most of those are traditional deep learning models, not what we think of as foundation models in generative AI. But I think in the next year, you're going to see an explosion of generative AI-based models that go through approval. So a good example is, there's a company that does medical imaging AI called AI Doc, and
Mhm.
they have practiced for years doing these traditional models, and they just took their first they kind of went back and redid an application, I think for bone fractures maybe. And they did it with a foundation model in a fraction of the time, and that's actually gone through FDA approval. It's the first one I'm aware of that's gone through FDA approval. But there's no doubt there'll be an acceleration. So much so, I think that the FDA is going to have to rethink how they evaluate these models and what the process is, because it's not going to be one algorithm that does one thing. It's going to be packages of capabilities that come with these models. And we just don't really have a way of thinking about that.
Yeah.
But that said, within an IRB or a private practice, you can deploy models experimentally and use them in clinical care. And that's happening now. We see it happening, in research, and there's so many publications talking about benefits and cool things that are happening. And I think we'll continue to gain momentum and experience there. And then that will become the foundation for this next generation of models that do perform more diagnostics and clinical decision support.
Yeah, it's such a great point. And, the FDA point's really important too, because the fact of the matter is that, an FDA timeline is often years, right? And I mean, we're talking about the current generation of models. Roughly every 18 to 24 months, we're seeing, a thousand-fold increase in capabilities. Like,
Yeah.
GPT-4 was a thousand-fold increase over GPT-3. We're going to see that again. And so, that's like, how do you when you're increasing the capabilities in the models so fast, like how do you keep up on the regulatory? It's a really interesting challenge. And
It's an
yeah.
Yeah, I was going to say it's an interesting challenge, but and I'm curious for your thoughts on this. The way I see it, like this is a necessary technology. There's really no other path to sustainable healthcare that's emerging that is as promising as using these technologies. So to the degree that there's urgency around this, and I think people in the FDA kind of recognize this, there's real opportunity here to redefine the way we think about, that process and accelerating, the entry into clinical practice.
Yeah, absolutely. Yeah. So the question from Stephen here in the audience is kind of relevant to this, and I think we can talk actually about an AWS partner here. Is Stephen saying, "Hey, this is how I use AI." And he links to a website, MedNexus. He creates a prompt to answer medical questions using ChatGPT 4.1. He's trying to create an OCR tool that makes calls using ChatGPT 4.1. But he says that HIPAA is really an obstacle for medical records. So how can you get an LLM in the HIPAA safe space? And I know that Pieces is an AWS partner, marketplace partner, similar to how Validic interacts with AWS, that I believe does this, right? I don't know if you can speak to
Yeah.
to kind of Pieces and how that technology works, but think that might be a good answer here.
Yeah, that's right. Pieces is doing this. And there's a lot of examples of LLMs powering applications that deal in protected health information. So you can do HIPAA compliant development around these models. And in fact, it should be, priority zero for anybody who's endeavoring to build these applications. And our technology stack allows for that in the same way we've done it with other services over years and years. And Pieces is a great example. And if you're not familiar with Pieces technology, is a company that basically integrates into Epic and does clinical summarization, document summarization or histories. And they can use that to help generate like discharge summaries and things like that. And you can imagine all of the horizontal expansion once you're embedded and looking at that information that's possible and they're executing in all directions. But the core technology beneath all of that is, in fact, LLMs. And I think they actually have some logic that routes between several different LLMs depending on the need. And Drew, you mentioned this earlier, and not to be too self-promotional, but one of the things that we at AWS believe there's a lot of value in having the right model that's the right performance and price for a specific application. Sometimes that means training your own model, pretty
Mhm.
rarely. But even for these types of applications like what Stephen's talking about, you may not need Claude Sonnet. You may be able to use a smaller, faster, cheaper model and get a lot of the same value. And there's a lot of value in being able to experiment and iterate and also future-proof your application. So when the next model comes out that might have capabilities you need, you can easily implement that. And you can do all of that in a HIPAA compliant way.
Yeah, absolutely. Yeah, I think that's right on. And there's like this space will continue to evolve. I would imagine EMRs themselves start to provide some of some of these capabilities natively as well.
Yeah, for sure.
But I guess maybe this is a good lead into to the next question I have, which is what advice would you give healthcare leaders who are just starting to evaluate Gen AI strategies? I mean, there's like so many companies trying so many things, and there's so much data. Like, how do you pick a starting point? How do you how do you set it up? Like it's a real challenge to just even really get started.
Yeah, it's not an obvious thing to people who are sort of feeling excited by these technologies and seeing some of the headlines, how hard it is to know where to place your bets and invest in implementing, typically with some kind of a POC and then ideally moving to production. Like these are not easy things to do in healthcare where, you're dealing with mission critical and very sensitive, care related technologies. But I think this goes back to something I referred to earlier, which is thinking in terms of risk stratification and experimentation. So starting with areas that have a lot of value, but are low risk. So
Mhm.
administrative workflows, patient engagement, navigation, things like that. It's a great way to get some of this value and do it in a way that, doesn't necessarily have a lot of risk in terms of patient care and delivery. And it's also a good opportunity to get the workforce used to using these technologies. There's a lot of, I think, fear and misunderstanding around artificial intelligence and is it going to take people's jobs and so on and so forth. And there's also a lot of very justifiable resistance within healthcare to new technologies because there's always been the next great mousetrap for healthcare, and typically it winds up creating more work for for healthcare practitioners, and sometimes the value is not so obvious. EHR is maybe the classic example of that. So there's a lot to be said for introducing things that deliver pretty clear value, they're low profile, and they get people, in the mindset of like what's possible, and then kind of going, incrementally from there. The other thing is really understanding what your KPIs are. What is success for an AI solution, and how many of these are you really set up to deploy.
Mm.
You have to have the right data posture. Things need to be laid out. There's a lot of sort of pre-work to get the maximal benefit. And so what we see a lot of times is there's a lot of excitement around new ideas and new models and POCs, but moving to production is actually quite challenging because scaling out across the IT infrastructure is just complicated. There's multiple systems, multiple, data silos, a lot of security and privacy concerns. And so I think you have to be very intentional and focus on the highest value things and make the right investment. And ideally, not one-off solutions, but things that offer, value across entire pillars of the care system.
Yeah, yeah, I think that's right on. The only thing I'll add is, and you started to talk about this a little bit, which is, pick kind of the easy, maybe non-clinical problems first, and that just to kind of extend that, um, we made a very, very intentional decision internally about 18 months ago, and we said, look, every company is an AI company now, right? Like it's not like just the companies that have a .ai after it. Like every company is an AI company, and that includes doctor practices, it includes health systems, it includes health plans. Like it is impossible to be a corporation today and not include this if you want to be a leader in the space. And I think that there are ways that we've found to bring AI into some of our internal workflows, just by leveraging some of the new capabilities of partners that we already have, right? So like for example, Slack is our internal messaging tool, and there's Slack. They introduced an AI capability that does really quick summarization of chats and like makes for really quick catch ups. And adds just some really nice, very lightweight features. Similar with we have an internal wiki called Confluence that uses generative AI to explain things like, what are these crazy acronyms that product engineering are using, like, and really just kind of help everybody, pull things together. And it actually uses just the internal data, your own internal data set to answer some of these questions, but it allows for that data to be pulled together a lot more seamlessly. And, similarly, like we're adding AI for our clients, right? So we're helping to summarize the data for them, or, create a progress note, et cetera. And so I think that like, a lot of the partners that health systems and health plans currently have, they're adding AI capabilities that are really relatively turn on experience that can start to add efficiencies for team members that will I think hopefully help get them used to the concept and then much more used to like, oh, now I see like this just saved me several minutes. Like this could be something that I can get more into, right? And then you start to kind of slowly work those AI muscles up over time, and then you can probably start maybe some of the bigger opportunities. But that would be maybe the one like the starting place that I would maybe look at. Um, so as we're thinking about uh, healthcare providers specifically, I'd love to talk a little bit about the like I don't know 8,000 pound gorilla in the room, which is the EHR and the clinical workflow that I was my son recently had his tonsils removed, and I was just kind of like looking over the shoulder at the nurse at the Epic instance at the hospital, and it still amazes me like how complex that environment is, and clinicians are used to it, right? But I was actually, I talked to the nurse about it afterward, and she said, the problem is that they're constantly making adjustments. So every few weeks they push a new thing, and like the button that was here is now somewhere else, and I have to like reorient everything that I do, right? And so I'm curious, are there effective ways that organizations can start embedding Gen AI into existing EHR systems and clinical workflows without disrupting like those those provider routines, right? Without
Yeah.
maybe like, oh, this was supposed to be easier and this is like not easier.
Yeah, it's interesting, right? That is the 800-pound gorilla. And as you know, like in hospital technology, there's always an assumption that, Epic's gonna, if there's something out there that customers want, Epic's gonna find a way to deliver it as a first party, which, I think is generally appropriate, but some might view it as stifling, innovation and creating a blocker. Um, and it's not always the case that they offer the best version of that solution. Um, but I've seen more openness with Gen AI to working with partners. And Pieces is a great example. They are fully partnered with Epic. In my mind, the best applications are ones that are fully baked into the workflow, whatever workflow system that is, Epic, Cerner, Allscripts, whatever it may be, and fairly transparent to the provider that it's even there. It's just making their life easier. Um, Pre-documenting, pre-populating forms, reaching out to patients, doing billing and coding, making recommendations where appropriate, not requiring more clicks and, cognitive burden on the physician. But that does require like a close partnership and tight integration. And it's not the easiest thing to do with these vendors. And look, like these are systems that are responsible for people's healthcare. Like you can't just let anybody, hack into it and add these things. So I think that balance is still being sorted out, but I'm pretty optimistic like we'll find the right, way to work through that. And then within that, the sort of like effective things I've seen are in this realm of like documentation. Can you do ambient documentation so that you don't have the nurse, navigating all around and paying attention to the screen and not the patient or the physician or whoever's working with the patient? Doing these summarizations. So for complicated patients with long histories, the provider doesn't necessarily have to go back and review it all, but the really salient things that are most relevant to the current encounter are highlighted for the physician at the beginning. Like those kinds of things are really low hanging fruit and lend themselves to being tightly integrated into those workflows. And I hate to say it like, and Drew, you know this as well as I do, but like, we come up with all these great technologies. I think it's really going to change healthcare. And the first place they hit is often revenue cycle management.
Yeah.
Um, and like, I actually think that's great. Like, look, optimizing that part of it and taking resources away from managing revenue and putting it back into care delivery is good for everybody. And so there's a lot of stuff that happens under the hood. Nobody has to be involved. It just optimizes the billing, the prior auth, all of that administrative work that sort of eats physician time and staff time so that they can redirect towards patient care.
Yeah. Yeah, you're totally right. And it's I'm okay with it tackling the administrative side as well. And my hope would be that those resources then get deployed toward clinical care. I think one of the things that I've heard in a number of ways and I'll kind of take this on two different sides. I'm curious your thoughts. So one thing that I've heard is that the way that the hope for a lot of the healthcare administrators is that these AI solutions will ultimately help clinical teams be more efficient. The trade-off there is that in order to pay for these tools that will help them be more efficient, like the healthcare workers are going to have to see more patients, right? Because like
Yeah.
somehow you got to pay,
Yeah.
and it's a real, I don't even know if that's a chicken and egg problem. I think that's
Yeah.
just it's just a problem, right? Like the healthcare workers are already overstretched. Like we can't say like, oh, here we're helping ease some of this burden and now ask you to do more.
It is a very interesting thing, right? Like we see this in radiology, like you there's a shortage of providers, so you want to create more capacity. So you could deploy tools that make the radiologist, 1.5, 2 times more efficient or whatever it may be. But they don't see the benefit of that. They just see twice as many cases, right?
Yeah.
But I think there is a little nuance there in that most physicians are okay seeing more patients or doing more volume if they feel like they're operating at the top of their license.
Mm,
If I'm reading cases and I'm really getting to zoom in on the complicated ones where my intuition and my experience and my judgment's important, that's pretty satisfying. If I'm spending my day going back and forth trying to get prior examinations to compare to current examinations and measuring lesions over the course of, 2 years and all these kinds of things that are not particularly highly skilled, uses of my time, that burns you out. So I'm not saying that's 100%, but there is some balance there where I think you could actually create a better experience, and increase throughput at the same time.
yeah, yeah, totally. I liken it to that cognitive load decrease. I liken it to it used to be when I would take a long road trip, wherever I would get to, after whatever, a half a day or a day of driving, you're exhausted, right? You're exhausted from driving. But now, I have the automated driving. Oh my, I have the Tesla has the full self-driving. It is not full self-driving, but it is pretty good on open highway, right? And the difference between driving and like actually like doing the work versus more, I'm overseeing and I'm ensuring that everything is safe, right? I'm paying attention, but I'm not like as active. The cognitive load difference is massive. And I arrive where I'm going and I feel like, oh, like I can still carry on a conversation and feel like totally alert.
Yeah.
I don't get as tired. And so I liken it to that. I don't know if that resonates with you, but
Yeah, for sure. I mean, all those things, it's context switching for physicians a lot of the time too.
mhm.
Interruptions in their workflow to help, give instructions to nurses or take a phone call or argue with an insurance company, whatever it is. And all that stuff can be offloaded and look, just not having to navigate those screens and click those boxes is the whole time and know that you're going to have to go do the documentation. Um, it just does open up the field of vision to be much more focused on the patient and not feel like you're accumulating like work debt, all through the day. Um, so, and look, I think the technologies, have kind of proven this out a little bit already. These ambient documentation systems, I don't know. I read reports every other day. Yeah, there's good ROI. No, there's not good ROI, but you can't take it back. Physicians won't give it up once they use it.
Yeah.
So, there's something to be said there.
Yeah, I totally agree with that. Totally agree with that. So we have a lot of questions coming through from the audience that are around more like real world use cases, and I'm going to get to that in a second. Before we do, I wanted to ask you to just talk a little bit about AWS Bedrock, and kind of how this works with health systems and helps them health systems and health plans and just like healthcare environments be more scalable, secure, all of that with AI. And just I know I said this earlier, but just to reiterate, we have built our AI solutions with Bedrock and it's been fantastic. And AWS has been a really great partner. So we'd just love to, give you an opportunity to share a little bit about why did AWS invest in Bedrock? Like, how does that really help in healthcare?
Yeah. Yeah, it's great to hear, Drew. And maybe you're better to speak to this than me, since you've got firsthand experience using it as a customer. But so Bedrock for us is kind of it mirrors the philosophy that AWS has used in terms of how we offer choice, um, depending on use cases, depending on price, performance, all these kinds of things, and some amount of future proofing to developers and end users. And so the Bedrock suite of models, and I don't even know how many there are now, but it's a pretty comprehensive set. They have differing performance profiles and price profiles, and we're constantly adding new ones. And so for developers and end users that are adopting these technologies, it gives you some comfort that you can manage the switching costs if something better comes along. You can experiment and be nimble, and you can also pick something that is purpose fit to your needs. And all of this with like all the regulatory and compliance and safety and security that you'd expect. So it's a great stack for developing health applications. We've seen a lot of customers do interesting stuff with it. The other thing I'd say, and I don't know where your head's at with this, Drew, but whereas Gen AI was the hot topic, 3 months ago, agentic AI is now the hottest topic
100%.
of the day. And Bedrock is very much, an agentic first focused suite of offerings, and we continue to release a bunch of features and new ways of using those models for agentic purposes. And so that's a super exciting, very active area, very new. I think people are still wrapping their heads around what agentic AI is and means and how you define it and how you deploy it. But it's extremely exciting.
Yeah, that's a really great point. And you're totally right. The agentic AI is, I mean, I think top of mind for everybody. It's at the core of the release that we just made, the new product announcement we just made on Monday, Validic Sparks. Like it uses generative AI to create sort of hyper personalized content, but the idea there is that what that can do is like supercharge the agentic AI for more, so you can like automate those personalized outreaches. Um, and I think that it's hugely important for scaling care, especially when we're not going to have more healthcare workers. Let's face it, right? We are going to have more patients, and so there's a big opportunity here with AI. So maybe just jump into a couple of questions here because we have a number of them piling up. And so I'm going to start with my friend Tony here, who I know he's personally very interested in hypertension. And, he basically says, we have sometimes seemingly complex simple problems that are actually very complex. So for example, hypertension, more than 3/4 of patients ultimately required 3 or more drugs. Yet often those selected by clinicians are not logical combinations. So is there a way to present a patient with, who has a specific BP, GFR, age, race, A1C, other clinical factors, and maybe have Gen AI suggest which agents this patient is likely to end up on? Is that something that, Gen AI can now identify automatically from EMR data, like who are the high risk patients and like which ones, could be that who need specialty care, which ones are high risk for secondary causes, which one would be benefit from certain agents? I don't know, what are your thoughts on that?
Yeah, I love this question because it lets me kind of wear both the life sciences and healthcare hat at the same time. And you know, first, like some of this stuff has been out there. You think about the sepsis models that were deployed, even 4 or 5 years ago to varying degrees of success. And that shows the ability to try and take multiple, measurements and feed them into a model and get predictive capabilities out of it. And depending on which model you look at and which paper you read, like, they work more or less. The actual implementation and false positives and things like that is a little bit of a more nuanced conversation. But I would say like on the life sciences side, there's a lot of interest in this for clinical trials because if you can get your hands on enough data to train a model and understand which patients are going to benefit from which therapeutics, it really lets you engineer a clinical trial for success from the outset. So there's a lot of work happening in this space, and it's happening on both sides, the healthcare and life sciences side. And the answer is yes, it's possible. I think the biggest blocker is getting enough high quality data, longitudinal patient data across enough different therapeutics to train these models.
Mhm.
And do it in a way where you've represented, diverse populations and you can validate that these things work in a variety of clinical settings and, give you the proper insights. And, um, to our earlier discussion about FDA approval, this would be an example of, I think, an algorithm that would require FDA approval if it was making clinical recommendations. So you've got a pretty big bar to overcome. So I'd say yes on the research side. There's probably a lot of examples of similar things. In the actual clinical care side, it's going to take some work, but I'm sure we're going to see applications like this and many similar ones in the not too distant future.
Yeah, absolutely. I think it's a really, really great response and way to think about it. And um, I'll say that we being in healthcare right now, um, we have so much opportunity to identify patients who are, at risk for certain conditions, et cetera, to provide more proactive care um, with just current technology, or I should say, let me just say technologies from 5 years ago and that we haven't implemented. And yet Gen AI does present like a really big opportunity to start identifying even more patients that could benefit. My sincere hope is that we can just switch to the healthcare system really providing that proactive care. Um, and as opposed to just the reactive. And maybe along those lines, there's a good question from Paul, which is, will health systems, do you see them employing Gen AI to interact with patients, like through voice agents, chat agents, or do you think that Gen AI will stay more behind the scenes to help those the human clinicians that talk with patients?
Yeah, I mean, I think this is already happening, and they're absolutely going to be talking to patients and doing follow up and scheduling and reaching out for check-ins and all the sort of care coordination things that are so difficult now. There's a couple of companies that are built just around this thesis. Probably the highest profile one I can think of is probably Hippocratic. And so
Mhm.
they sort of look at it as a nursing augmentation play where agents will go out and call patients and, check in on them post-surgery or post-admission or whatever it may be, or chronic disease management. There's another company that has a product called Tom out
Mhm.
that does something very similar.
Yeah.
And it's good. I mean,
Ellipsis
look,
Health with Sage. Yep.
yeah,
Mhm.
yeah.
Mhm.
Yeah, like they work great. Like for these kinds of applications, I think it's probably in some ways going to be a better, more responsive and more personalized experience than trying to get a nurse to do these calls like between other things. Patient acceptance, I haven't really seen any data on this, but I think, I think people in the balance of like fast care versus like talking to a human, we'll see where that falls. It's going
Yeah.
to take a little getting used to.
Yeah. I mean, my sincere hope on that, like you're totally right, like fast care versus human care. And my sincere hope is like there are certain times that you really need to talk to a human, right? And when you do, like you really do. And when you can't, it is like kind of scary. Um, but there are other times when you just need something done, like something you need a quick question answered, appointment moved, something, right? Something more administrative. Um, and maybe even like the health systems need to check in on you and just kind of see what's going on. Like I think that's an area where like fast could actually beat human all the time. And um, I'll just say two quick things on this. One is my sincere hope on the agentic side is that, and I haven't seen any of the companies do this yet, but I'm a million percent sure this will be a fast follow because it's just too obvious for it not to be. But I really hope that they move to like they're all very focused on voice right now, and I want them to be focused on like multimodal. Like for me personally, I don't want a phone call to answer some basic questions. I would rather just get an SMS message or a push notification where I could just answer some questions in an app, right? Like that would be my sincere preference because that's faster for me. My 95-year-old grandparents who are very much on the decline, unfortunately, but your 90s are very hard if you're fortunate enough to make it into them, right?
Yeah.
But like they definitely would need a phone call. right? Like absolutely, and the voice agent would be great for them, I think. Um, and so I think if we could have like a multimodal approach that allows you to kind of personalize and tailor to the person, what, you get the same data, but the modality of delivering it and capturing the data is different. I think that would be helpful. And the last thing I'll say is that on this is that, I've seen some demos where I think that the AI agents can actually be more empathetic than humans, right? Because humans, especially in the workforce and in healthcare, don't have much time. And sometimes people want to, like, I've actually had this experience where, like, I'm talking to a doctor either in person or the phone, and I like have a few more questions, and I can tell they're getting a little antsy, right? Like, they're like, "You're fine, dude. Like, you're pretty healthy. Like, you are optimizing. I need to get to the next bed for the person who's like, or to the next room for the person who's like actually sick, like rather than help you optimize, right?" And whereas, like I saw a demo once from one of these AI care manager companies where they made a phone call to somebody who was on they were newly diagnosed with something on new meds, and there were some food complications, like concerns around food interactions, and so she basically said, "Well, can I have bananas and can I have grapes? Can I have this?" And like she opened up her refrigerator. Can I have peaches? Can I have this, like she literally listed all of the things in her refrigerator and then moved on to her pantry. Can I have rice cakes? Can I have it? And like the AI for 20 minutes sat through and like answered every single one of those questions patiently, which is far more empathetic than you would ever get from a human, right?
That's right.
So I think
Yeah,
that's, yeah.
and also people might share things with AI that they might not want to discuss with a person.
Oh, I think that's a really interesting point. Yeah, that's a really good point. Yeah. Huh. Yeah, that's super interesting. So, I'm curious, are there any other like unique or interesting use cases around Gen AI that you've seen that you think like, oh, that was pretty interesting, or have
Yeah.
we covered them?
Yeah, actually, just based on that last comment, have you seen this company called He Health out of Singapore?
Uh-uh.
That's a cool guy. They do basically you take a picture for men to detect STDs, and
Oh, wow.
you think about the
Like down there.
yeah, yeah, yeah. So they've got some interesting slogans and stuff. They have fun with the idea. Um, but you think about, global healthcare and the stigma around these things, and it's really pretty compelling, right? And pretty accurate. So that's a great application.
Yeah,
Um,
super interesting.
one of the ones that's interesting, and I think this is where you start get towards the cutting edge, is like there's all kinds of signal out there that humans just can't detect.
Hmm.
So you think about picking up structural heart disease from an EKG or detecting the beginnings of dementia or Parkinson's or ALS from a voice, and the models that can do that. There's some really compelling research in that area. So I don't know, how many of those things are going to make it to fruition, but like once a week you see something, you think, holy cow, like this can really have some radical implications for how we think about diseases and early diagnosis and detection and monitoring side effects from medications and progression of disease and all these kinds of things that are, super relevant. And it goes to the RPM space. Like if you've got
Yeah.
all this data, what's hiding in there that could really give us some insights, and maybe let us take some preventive measures.
Yeah, absolutely. Yeah. Yeah, it's really fascinating what you can do with the right data and the right training, right? Like, yeah, we actually showed with machine learning, this was now years ago, but we could predict, when someone's going to stop using a wearable device. We can predict blood glucose values a week in advance, like within the accuracy meter itself. And it's really interesting. And the super interesting thing about those predictions is that at the time, this was like 2016 to 2018 when we were doing this initial machine learning work. It was kind of like, so what? So you can tell that someone's going to stop using a wearable device. Like, so you can tell that someone's blood glucose, whatever. So you can tell someone's blood pressure in the future. It was kind of like, well, what do we do with that? But now that we have the agents, the AI agents, like now it's like, oh, like this could be a prompt to reach out and not say, hey, we know the future, but to say, hey, we know something might be changing for you. Like, what's going on? Have you had any changes in your home environment? Have you had any whatever? Like, are you feeling more stress at work or whatever the case may be, right? Like maybe you can kind of get into their psychographics. Like what is, do you remember why this is important for you?
Yeah.
Right. I think there's some real opportunities around the agentic AI to start to really drive that patient engagement in a unique way.
Yeah, I think that patient engagement area is not talked about enough, right? That's actually perhaps one of the hardest things to crack.
Yeah.
And so, with all this chronic disease management, and I have some road rash here from the startup I had in the space. Like the hardest thing is to keep people motivated and engaged and following the advice and recommendations and program. And it's understandable, right? Like these are not do it for 4 or 5 weeks. It's like make these changes for the rest of your life. But
Yeah.
if you had a passive way of looking at data, which we do, and seeing some inflection points to intervene and provide just-in-time notifications, but do it in a way that's really personalized and engaging, you could start to maybe break some of that down and keep people engaged and on the right track. So it's incredibly compelling. To me, that's the holy grail in digital health is to really start to get through that.
Yeah.
On the front end of the curve, there's people who are going to do great no matter what. But behind that, there's a real engagement block that I don't think anybody
That's right.
solved.
Yeah. Yeah. That's totally right. So I was mentioning to you, I was at HHS yesterday as part of this meeting that the Consumer Technology Association had, and one of the things that HHS was saying that I felt really aligned with was they said, look, the fact of the matter is that our healthcare expenditure is increasing at twice the rate of our GDP, and we're going to bankrupt our country at that rate. And we kind of have a choice, right? Like 20 years from now, we can be on the current path and have it be, even more healthcare spend and all that. Or we can recognize that like, hey, we're behind every other Western country from a, per capita spend and just a general health perspective and recognize we're an unhealthy country and start to make changes to be more healthy and more proactive about health and really ultimately like my words, not theirs, but ultimately help people be make healthier choices for themselves, right? Be more self-driven in their healthcare. I think that's a real opportunity here with a lot of AI, and there's a lot of politics around this, right? But taking that out, like I felt very personally aligned around like, yes, like that's what we've been trying to do for the last 12 years is like help people get better with their data.
Absolutely. Yeah.
Yeah, yeah. Okay, so let's kind of shift a little bit to some of the challenges, and I want to talk about, we've kind of talked about some of the challenges of like, selecting products, getting started, but I'm curious if you've seen some of the challenges around like, technical, clinical, administrative governance challenges around implementing technologies. I will say one of my clients, they have four different AI committees, which it's a big enterprise, but still, it's really there's levels that you have to get through, right, in order to just to even get the right meeting, so to speak.
Yeah.
And so I'm just curious, like, how can these organizations, like large enterprise that are rightfully concerned about patient safety and all that, like overcome these challenges fast enough to keep up with the pace of technology?
Yeah. I mean, I guess I don't know. I mean,
Yeah.
right? Like I see both sides of it, right? There's good reason to be conservative and cautious and move slowly. But to our earlier discussion, these things are required. Like we need to do something different. We need to embrace technologies that have some promise of, being a release valve for what's building up in the system. And so I think where organizations can streamline their decision making and align on a framework to think about AI, I think a risk stratification approach, a KPI approach, a budgetary ROI approach, like get those things clear and, trying to do it in a holistic way. I think too often part of the reason why there's multiple layers and multiple things and there's stuff happening in one part of an org that's not happening in another is it's ad hoc, reactive, one point solution at a time. And
Hmm.
so I think there has to be a shift from the top down to say we're gonna pick the right partners and look at the entire system and how are we positioning our data? How are we securing it? What meets the bar for us in terms of AI? What are the high priority things that we want to accomplish that we know are achievable? Where are we willing to be a leader? And where are we more comfortable being, maybe followers, the wrong word, but like not necessarily on the cutting edge? And getting that written down, getting a small group of people together who are aligned on that, and then that really gives you the foundation to operate on. The reactive mode is not a success path, right? You can do that for a little while, but it just doesn't create a durable framework. And I think you need that because, like you said, this is all happening so fast. You're going to be way behind if you don't have just a lens that you look through these things that you feel confident, everybody's on board with.
Yeah, I totally agree with that. And I think any organization that has not yet or is not about to say from the top down, AI is a part of how we're going to do business going forward, I feel like is just going to get left behind, right? Like it's just things are moving too fast. Like this is like an internet level technology where it's things are different, right? They're different today than they were in the future or than they were in the past. Um, and so, kind of maybe bringing this in for a landing, I'm just curious, like, you know, you went to medical school, I won't date you here, a little while ago, right?
It's been a while.
Uh, but if you were talking to a first year medical student today, what advice would you give them around all of this? Like, how might the way they're practicing medicine and their careers be just completely fundamentally different from the way that you practice medicine and those who've been practicing medicine for the current generation?
Yeah, that's a fascinating question. Do we have another hour to talk? The short of it is, I think it's radically different, right? Even now, there's too much information. I don't remember what the stat is that people throw around about the rate of new publications and research and therapeutics and understanding of disease. Like there's too much new research and discovery happening. The diseases are too complicated. There's too much diagnostics now, molecular diagnostics, all the genomics we're doing, all the imaging. No one physician can be a master of all that. And I
Mhm.
think for a long time we tried to, when I went to med school, when you got off, you were like, they fully filled you up. You were right at the pour over level. And then you kind of went out and practiced and forgot a bunch of stuff and, kind of hopefully kept the important parts in your mind. But it was really about what you can keep in mind, how much you know, and then go out and use as the art of medical care. I think that's going to shift. I think it's not going to be about memorizing all of this stuff and reading, New England Journal and feeling like you know all the current thinking. It's going to be about using tools to guide your decision making and augment your clinical acumen and deliver better care. And so these tools are going to be AI based. They're going to draw on tons of data, tons of research and literature. And my advice to any medical student is, embrace it, understand it, know how to master it and use it. Um, have an awareness and a competency so that you can really get the benefits of these technologies because they're coming. And I think it's just, nobody knows what the future is going to look like, but for sure, that's going to be as important an instrument for healthcare as a stethoscope or a physical exam or whatever, we've used in the past.
Yeah, absolutely. Hopefully, it doesn't take quite so long to implement, right? I think the thermometry was around for 70 years before it was widely adopted in medical practice.
Yeah. Yeah.
But yeah, no, I think that's such a great point. And maybe to summarize what I heard you say is it's going to be important to shift from being the one who knows to being the one who knows how to know. Like,
Yeah, that's right.
how do
That's
you
good.
get, like, where I know where to go to get the information, right? It reminds me of there's this story, who knows if it's true, but it's a great story that Henry Ford was one time interviewed by a reporter in his office, and they said, well, hey, we have some, some pretty detailed questions. Like, do you want to bring anyone else, into the meeting? He's like, no, 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 you can ask me anything you want. And they were like, okay, great. And so they'd ask him a question about, the production volumes on the line. And he picked up his phone, he dialed the number, he asked the question, he hung up, and he gave the answer. And then they asked him a question about, something related to, compensation for his workers. And he like picked up the phone, he called somebody, he hung up and gave him the answer. And I think like that is what I think good leaders have always done, right? Is that they've recognized, hey, so I don't need to be the one who knows everything, but I need to know who knows. And I think the knowing who knows is changing. Like it's now the who there is not a who. It's a what, or a what system, or how to ask the question, and to how to ask the question of a model that we can trust, right? It's just such a fascinating time. And speaking of time, we're at time. So Jared, really appreciate this, man. It's a lot of fun. I'd love to get together maybe at a time in the near future and do it again and see what's changed, because like this space is evolving so fast. I'm sure we could easily fill another hour. So thank you so much, and thank you to the participants who asked questions. Really appreciated it. If we didn't get to your specific question, we'd be happy to follow up. You can also just email us hello@validic.com, and we'll respond to you there. But yeah, thanks so much, Jared. Really appreciate it.
Yeah, thanks, Drew. It was a pleasure.
Yeah, absolutely. All right. Talk soon, everybody.
Bye bye.